Hi, everyone, and welcome to the Inner Athlete Training Podcast. I'm your host, James Jankiewicz, and with us today is Martha McKittrick. Martha is a registered dietitian, a diabetes educator, and has had a specific focus on PCOS. Martha, how you doing?
Great, James. Glad to be here talking about a subject that's near and dear to me.
Well, we're excited you're here because we got a lot of learning to do. So let's begin with yourself. Let's just do a little background on yourself and, where do you come from? What was your education and what eventually led you to this discipline?
Sure. So I'm a registered dietitian. I've been practicing for over 25 years. I'm originally from Massachusetts. I went to UMass. And then in order to become a registered dietitian, you have to do an internship. So I came to New York City many years ago to do my dietetic internship. And then I loved New York City and I ended up staying here. I got a job at the hospital. And initially I was on staff at the hospital working in like all different kinds of areas. But then I started my own practice at night because I'm not like a 9-to-5 person. I like to do a million different things. So I started my own practice at night. I taught aerobics in a health club. I was into sports nutrition for a while. I was doing corporate nutrition. I was kind of like doing a lot of different things. But then I was working for WebMD and I was running one of their message boards. And I got a question from a woman on the message board who said that she was having a hard time losing weight. And she was eating like a really healthy kind of, low-fat diet. And this, again, was in the 1980s or 1990s where we were really into like low-fat diets, right? So that's what we thought was good back then. And she was exercising. She couldn't lose any weight. And then I asked her if she had any medical problems. And she told me she had PCOS. So at that point, this is probably actually the 1990s. At that point, I'd heard of PCOS before, but I didn't really know what it was. So I asked this doctor who I was working for, Dr. Louis Aroni, who specializes in weight management. And I asked him, what's up with PCOS and weight loss and all that? And he said they're insulin resistant. So I did some research and then I found out there's a link between PCOS and insulin resistance. And so with this woman on the message board, I said to her, let's try like a lower carbohydrate approach. Like, let's change things up a little bit. And we did. And then she was finally able to lose weight for the first time in a long time. And her symptoms started getting better. And then she introduced me to her doctor in New York City, Dr. Walter Futterwhite, who's kind of like a PCOS kind of guru. And that's how I kind of got involved. So I got involved with various organizations and I kind of lectured across the United States for women with PCOS and for healthcare practitioners, just really getting involved in it. And, and that's kind of a main specialty of my practice. I just find it's interesting. And what's mind-boggling to me is that it's such a common condition. Now they're saying it might affect up to 20% of all women, but so little is still known about it. That's what kind of is mind-boggling to me.
And that's great because it's rare. Usually people get into a particular passion or topic because they've experienced it. And right. You're not in that boat. You're just like... No.
Yeah, I don't have PCOS. People ask me that all the time, like, why are you so passionate about it? I don't have it. It just kind of like, I don't know. It just kind of, I just feel like really bad because I just think it's an area where women can really be helped with nutrition and lifestyle. Like I like helping people. That's why I'm in the profession that I'm in. And it's just an area that there's just so little known about it. And these women just don't get diagnosed. They don't get helped.
Okay. So let's start from the beginning. Define PCOS. What is it exactly?
Yeah, it stands for Polycystic Ovary Syndrome or ovarian syndrome, two ways to say it. And it's when you hear the word, like people tend to think of, it's just like cysts on the ovaries. It's not really what it is. It could be, but it's a very common hormonal, it's genetic and it's hormonal and it's reproductive condition. And it affects up to 20% of all women. So it's really, really common.
So it is genetic.
It's genetic. Yeah, it's highly genetic. If you have it, there's like a 40% chance that your sister has it. There's a very great chance that your mother has it. If you have a daughter, there's a good chance she'll have it. And there's even kind of like a male PCOS. It's not really PCOS per se, but if you have a brother who has it, he has an increased risk of having a metabolic syndrome where you have elevated blood sugar and maybe increased risk of heart disease. So the thing is, it's it's not just a reproductive condition, which is what we thought of for years, right? When it was first diagnosed in 1935 by two doctors, Stein and Leventhal, because it used to be called the Stein-Leventhal condition. But it got changed to PCOS. But the way it was diagnosed is these doctors noticed that there was kind of a link between women who did not ovulate and women who had cysts on their ovaries. So for many years, it was just believed to be a reproductive condition. Now we know it's metabolic, reproductive, and hormonal, and it affects the whole body. Really, it affects the heart, the gut, the skin, the mind, the reproductive organs. So it just affects everything because it's hormonal.
So walk us through a little bit of the history, if you will. You mentioned the two doctors whose name it was after. How did they stumble upon it? Like, did they mistake it for other conditions at the time?
Honestly, I don't really have that information. I just know it was called Stein-Leventhal, and for many, many years, it was just believed to be women who have cysts who have the anovulation and who had trouble getting pregnant, cysts on the ovaries, and it was believed to be that way for a very long time, because even in the year, probably maybe 1997. I tried to write a paper on it in a nutrition peer-reviewed journal. I won't say the name of it, and it's a major one. And so I submitted my proposal to write this article, and I was going to address insulin resistance and all that. And my article got denied because they said it's just a reproductive condition, has nothing to do with insulin resistance. So even at that point, they didn't really know it. So this Dr. Futterwhite wrote a note, because he was like a head guru at Mount Sinai. He wrote a note, and he showed some of his research, and he sent it to the journal, and then they finally agreed to let me write the article, because I guess he helped prove that it wasn't just reproductive. So it's taken a long time, and now it's even evolving now, because now they're linking it to low-grade inflammation, into alterations in the gut health. So we're learning even more about it.
So what are some of the common symptoms? Like somebody who, they might have it, they might not, but what are the things that a woman would look for if they think they might have it?
Yeah, I mean, there are so many, because it's hormonal, so it affects the whole body. It could start with irregular periods or no periods. Excessive hair growth called hirsutism, which could be on the face or the body. And a lot of times, you look at a woman and you don't see hair on her face because she will do something about it. So a doctor may not even think to ask the woman, do you have excess hair? So that if you have an ultrasound done, you may find small cysts on the ovaries, and they're not actually cysts per se, they're just follicles that never ruptured. And so they call them a string of pearls. They're very, very, very tiny little dots on the ovary. So you might find that on ultrasound. 80% of women have that. Trouble with hair thinning or hair loss, called alopecia. That might affect 40 to 70% of women who have this. And that's a particularly devastating symptom, because there are things you can do about it, but that one's a little more difficult to treat than other ones. And of course, it's extremely upsetting if you're losing your hair. Another one could be dark patches of skin, like on the back of your neck or under your arms or the groin area. That's called acanthosis nigricans. And then you get into things like mood disorders. Women with PCOS have higher rates of mood disorders, depression, anxiety. It can also affect the mind for many reasons. There is an increased risk of diabetes and prediabetes. 50% of women get prediabetes or diabetes by the age of 40. There's an increased risk of heart disease, increased risk of endometrial cancer. But the typical, I'd say the way the typical woman may diagnose it, it depends. So you could see that you are, acne is another one. So you might all of a sudden see that you're getting really bad acne, and you might go to a dermatologist, and they might actually be the ones to diagnose it, because it presents through the skin. Or if you're having a lot of hair growth on your face or various parts of your body, you might go to have laser or electrolysis, or mention it to the dermatologist, and sometimes they're the ones that pick it up. Or if you have the irregular periods, you might go to your gynecologist, and hopefully the doctor would check your hormone levels before just putting you on the pill, and then it could get diagnosed that way. And another way is there could be a rapid weight gain for no reason. And I see this a lot like women don't do anything different. They're eating the same way, they're exercising the same way, and all of a sudden they start gaining this weight pretty rapidly. And that's obviously extremely upsetting. So maybe they would go to an endocrinologist and then it could get diagnosed that way. So it presents in many different ways. And that's why it's so confusing, because, if you have diabetes, it's easy. You go get a blood test, your hemoglobin A1C is over 6.5, so you have diabetes. Or if your cholesterol is like over 220 or whatever, you have high cholesterol. But with this, it's much more difficult to diagnose.
So a woman could have one or quite conceivably all of these symptoms, correct? What is there a particular age this starts occurring?
It really, they call it a condition of women of reproductive age, but it can go past menopause. It just manifests itself differently. Obviously, it's not going to be reproductive if you're 60, but it turns into more of like a metabolic condition as you get older. And that's where your risk of diabetes and heart disease is even higher. And even girls as young as like age 8 or 9, like if you have a daughter and she has her period like really, really young, called precocious puberty, she may have an increased risk of having PCOS. It's hard to diagnose it at somebody that young age. Just obviously you can't do like, a pelvic sonogram and all that, but you just want to watch for signs and symptoms of it. So it can happen at any age. Where I see it, I guess a lot of my clients are maybe in their like 20s and even 30s, but it can happen really at any age.
Does it affect a particular demographic?
Not that I'm aware of. The statistics vary widely, and part of it is because it's being diagnosed differently. The way there's different sets of how to diagnose it. Right now, most doctors use something called the Rotterdam criteria, and the woman must meet 2 out of 3. So what these things are. So one of them would be irregular periods or no regular periods, and having no ovulation or irregular ovulation. So that's number 1. So if you have irregular periods. Number 2 would be hyperandrogenism by laboratory testing, so like high testosterone, DHAS, or clinical signs of it. So what that would mean is if the woman had acne or if she had hair growth or hair loss. So that would be a sign of hyperandrogenism. And then the third one would be the polycystic ovaries on a sonogram. So a woman would need to meet 2 out of 3 of these. And then if she met it, then she would be categorized as having PCOS. So to answer your question, sorry, I kind of went a roundabout way. There's no particular demographics. They do say that some demographic areas might have higher rates, but I'm not exactly sure why that would be. But kind of the statistic that I'm hearing mainly is 5 to 20% of women. And that might be based on what kind of diagnostic criteria the doctor's using.
So so we know what the symptoms are, but like, what is it? Like, what's undergirding it? Do they know? Is there a trigger switch or?
Well, it's a hormone imbalance, basically, is what it is. And basically.
So you would define it more as a hormone imbalance rather than a metabolic phenomenon.
Yeah, but it's kind of known as genetic, reproductive, hormonal, metabolic. So anytime you have hormones involved, it can affect like so many different things. So basically it's a hormone imbalance, and what the hormone imbalance can cause, it can cause high levels of androgens, which are the male hormones. And these high levels of androgens come from the ovaries and from the adrenal glands. So that's part of it. And then it's also believed, because it's super complicated, that's the whole thing with PCOS. There's so many different kind of like parts of it. And then it's also believed there's some kind of dysfunction between it's a hypothalamic pituitary dysfunction. So that also kind of affects the hormones that are produced in the body. And then lastly, there's insulin resistance, and it's believed there's just a genetic defect in the kind of the receptor gene, the receptor for the insulin on the cells, especially in the just the cells throughout the body. So the body's become insulin resistant, And then and that can lead to more inflammation, and it can lead to higher production of androgens, because the way I like to explain it to my clients, like I have all these visual animated slides to show them. So if you think about insulin resistance, because I think it's super important for people to understand insulin resistance, because it's probably at the heart of this. It's believed that anywhere from 75 to 90%, not 95% of women who have PCOS are insulin resistant. And if you can improve your insulin resistance, you can improve your hormone balance. So I know we're going to get to the root cause of PCOS, but a lot of this is going to do with insulin resistance. So kind of like what I like to explain to my clients is, envision when you eat carbohydrate, and it could be any kind of carbs, good carbs, bad carbs, all kinds of carbohydrates, they raise blood sugar. And when the blood sugar goes up, your pancreas makes insulin because it wants to get the blood sugar back down to normal. So in normal metabolism, your body makes the insulin opens the little doors to the cells. You have millions of cells in your body. You have fat cells, muscle cells, liver cells. So the insulin opens the door and your blood sugar is back down to normal. So the more carbs you eat, the more insulin you make. It opens the cell doors. Blood sugar is normal. But with insulin resistance, it's the same thing. You eat the carb, the sugar goes up, you make the insulin. But think of the cell doors being kind of stuck. Like if you have a key and you're trying to unlock a door, and the door kind of gets stuck. So envision that in your body. So your body has to make more and more insulin to open the door. So it finally opens the door, it gets the sugar, and you don't have diabetes, but your body made all this extra insulin. And so all the insulin goes to the ovaries, and the ovaries are very sensitive to the insulin. So the ovaries get the insulin, and that makes them make more levels of the androgens. And that's kind of what fuels the PCOS. It's because now you have these high levels of testosterone and these other androgens, and that's causing the irregular periods, which causes the cyst on the ovaries. There's a link between insulin resistance and inflammation, so that can cause more inflammation. So it's complicated.
Who diagnoses it? You have to go to a doctor to get an official diagnosis?
Yeah. I think it depends on like what. First of all, it depends on the doctor, right? If they're going to pick it up, it would be diagnosed by a doctor. But there have been many clients who I've had who have had trouble losing weight. And, I'll say, what are your periods like? And they might say, oh, I'm on the pill, so my periods are regular. But I was like, well, were your periods regular before you went on the pill? And they may say no, or they may say, I don't remember. And then I'll say, well, do you have any trouble with hair growth or anything? Or I might notice they have some acne. So then I'll say, you need to go to your doctor, and, you need to get tested for PCOS. The thing is, you can't get tested while you're on the pill, because that alters your hormones. So if you get your hormones tested on the pill, it's not going to tell you anything, because your hormones are going to be totally changed. So like, somebody like me, or somebody like you, or a dermatologist, or somebody, an electrolyst could recommend they get tested, but they really need to get blood test, and they should probably also get the pelvic sonogram to check for the cyst on the ovaries. And then just an exam by a doctor too. So ideally, like an endocrinologist might be the best doctor who could diagnose this.
So you're saying it would be easily overlooked by a common...
Oh, very easily.
Okay.
Very easily. Yeah.
That's interesting.
Yeah.
So, all right. So let's assume you have it. What are some of the, before we go into the lifestyle changes and whatnot, like what would be some of the more traditional orthodox medicine approaches to it? What would a doctor do?
Generally a doctor is going to look at, what are their symptoms, if they're having irregular periods, or if they're having like a lot of trouble with their skin, like they're having acne or hair growth, the doctor may recommend a birth control pill, because that helps to decrease the levels of androgens. It kind of helps to regulate your hormones a little bit. And they may also recommend a medication called spironolactone, which is an anti-androgen. So it kind of blocks, it's going to help to lower the androgen levels, like will help to lower the testosterone levels, and that will help clear up skin. So those are two common ones. And then it depends on, like, I guess what other symptoms they're having, like, or if the woman's trying to get pregnant, they might jump right to, Clomid or something like that. But the common ones really would be the birth control pill and spironolactone. And if they're overweight, they're probably told to lose weight.
So a person with PCOS could conceivably be on many medications for this.
They could. And another common one is a medication called metformin, which is kind of used off-label for PCOS, but it's kind of a medication for type 2 diabetes. It helps to lower insulin levels in a roundabout way. So that can help many women with PCOS. So generally, for most women, it's birth control pill, possibly an anti-androgen like the spironolactone, possibly metformin. If they're trying to get pregnant, they might be on a fertility medication. And then they'd have to look at, does the woman have high cholesterol? This is not specific towards PCOS, but yeah, they could be on a lot. They could be on a medication if they had high cholesterol, like a statin. They could be on medication for blood pressure, because these are all associated with PCOS. And then the doctor probably just tells them to eat less and lose weight, basically, if they're overweight.
Right. And all these drugs obviously are going to come with their own
totally. Yeah.
Their own plethora of symptoms, obviously.
Yeah, like
so
nutrient deficiencies. The metformin can be very difficult for some women to tolerate. It can cause a lot of abdominal pain, diarrhea, gas, bloating, nausea. Some women don't experience any side effects, but a very common side effect is what I just said. And especially because with PCOS, you tend to need higher amounts compared to if you had type 2 diabetes, which I know sounds weird, but with PCOS, there tends to be greater levels of insulin resistance, even more so than with type 2 diabetes. So a woman might be taking 2,000 milligrams of metformin, and it can really upset their stomach. So you have to take it with food and all that. But yeah, so a woman could be on a lot of medications.
Wow. So let's go into more about how you would normally treat somebody. Let's look at a more, naturalistic approach first. I mean, well, let me ask you this. Like how, I guess the question is, you don't know how many drugs are going to be put on, but would you say like the birth control is like the standard? Is that like probably the most basic one they're on?
I would say the birth control pill is probably the standard, and maybe metformin might be pretty standard too.
Okay. So then how, if we didn't want to go down that route, what would be some of the other options?
You can definitely, lifestyle should be definitely part of the treatment plan. And I would say lifestyle should be number one, because the root causes of PCOS, we don't know exactly what causes it, but we do know there are at least 3 kind of root causes. And one of them is insulin resistance. And one of them is like a low-grade inflammation. And then now they're finding out there might be a link between some kind of gut health or kind of abnormality or alteration in gut health. So those are the 3 main ones. And then, there's also the general hormone imbalance, and lifestyle can help with overall hormone imbalances, like, for example, getting enough sleep or managing stress. Many women, it's hard for me to say what percentage, and then we can use supplements too, but many women can manage PCOS with lifestyle, but not everybody can. Some women really do need or really do want to go on the birth control pill, because let's just say you have really, really bad acne. That's due to the high levels of the androgens, and you do everything right from a lifestyle standpoint. You've tried to cut out dairy, you're doing low glycemic, you're using the right kind of skincare products, you're doing everything right, and your acne is just out of control, and it's like ruining your life kind of thing. Birth control pills may help women in that case, because it does help to lower the androgens, and it can help skin a lot. And also, in terms of your period, you do need to shed the lining inside. So, some women, they try to do it with just nutrition, lifestyle, and they can't. Some women also have like endometriosis or really, really bad cramps, like horrible cramps, and they find unless they're on the pill, they can't manage it. So like medications definitely have a role in this. And I have had a lot of clients who've had a lot of success using metformin. I know there's a lot out there on social media, don't take medications, they're bad, do everything natural. I think you need to start with natural. And then if you need a medication, don't feel like you're a failure because you had to go on a medication.
And those symptoms of the medication that you expressed before, that doesn't happen with everybody all the time.
No,
right? Some people can take them and be fine.
Yeah, it doesn't actually. I have one client right now who I always tell people if you have to go on metformin, you should start with one pill a day for like 2 weeks, take it with a meal, and then slowly ease up to whatever dose the doctor wants you to be on. You generally need to be on 1,500 to get results with PCOS. But I had one woman whose doctor didn't tell her to ease up, and she just started with 3 pills a day, and she's fine. Where other women, they take one pill and they get all the side effects. So you just have to start slow and go up. And if you can't tolerate it, if it's making your life miserable, don't do it, because there are some supplements which could act kind of like metformin, which are all natural.
You mentioned before that inflammation's part of it. So
yeah, it is. And that's something that like when I first got into PCOS, like we never talked about inflammation. Like in the beginning, we weren't even talking about insulin resistance. And then we finally got into insulin resistance. Like, for example, I wrote 2 chapters in this book. I think it was in 2004 or something. It was called The Patient's Guide to PCOS. It's written by Dr. Walter Futterwright. And I wrote the 2 nutrition chapters. And at that point, we were only talking about like insulin resistance and weight loss. So I'm kind of like embarrassed now when I look at the chapters that I wrote, because I would never tell people these things anymore. But, we were kind of saying like, take your calories really, really low. And I was even telling some people, in the book, like have, you can do artificial sweeteners. You want to make sure your carbs are low. Like now I wouldn't tell somebody to do that because we didn't know about inflammation and gut health back then. So I would like to do a redo on that chapter.
Right. And when you mentioned those, inflammation, gut health, and what was the other one? Oh, insulin. Right?
Insulin, yeah.
So those are 3 that can obviously be managed
exactly.
very well now in this modern day and age, just with basic lifestyle changes. So let's take them one at a time. So what are the things that a woman should be doing who might have this condition? How would you coach them in terms of what would be their first strategy?
The first thing I would probably address would be insulin resistance. And I would just want to do, because I think when people hear about insulin resistance, all they think about is, I can't eat any carbs, like, because that's what you read on social media. That's all you think about. And you might load up on tons of like meat and I see a lot of meat, tons and tons of protein, and just not enough healthy berries or some healthy foods that are good for insulin resistance. So I would want to educate the person, first of all, what is insulin resistance and what are the things that you can do that will improve it? And there's so many things that you can do. First, I guess I would say to choose healthy types of carbohydrates. So you want to avoid like the white processed carbs. It's going to shoot your blood sugar and your insulin up really high, really fast. So choose healthy types of carbs, limit white carbs, limit sugary carbs, but practice portion control of all carbs. Because even if you're doing a healthy carb like whole wheat pasta, for example, but you're having like a massive bowl of it, you're still going to shoot your insulin up, which you don't want. And then eat a balanced meal. So combine some protein, some healthy fat, and some healthy carbs at meals, and that's going to cause a slower rise and fall of blood sugar.
Right.
Eat as much fiber as you can. Fiber is like a superfood for PCOS for so many reasons. Maybe add some like ground flax seeds to your oatmeal, or put it in your smoothie. Try and get in some beans, get in as many vegetables as you can. Fiber helps to improve insulin sensitivity and improves gut health. It slows the rise and fall of blood sugar. So again, that's something a lot of women don't think about. They're so kind of into, let me cut out all carbs, let me go keto kind of thing.
Yes.
So you want to get the fiber in there. Meal timing, which is super interesting. For many years, we just really focused on, if somebody is trying to lose weight, we just focused on calories. And then we focus on, okay, well, the quality of calories matter too. We can't eat all this like processed crap. But now some of the studies are looking at the time of the day that you eat. And it turns out our bodies are more sensitive to insulin earlier in the day. So I might say to a woman, don't eat the typical American diet where you don't eat much during the day, but then at night you load up with all kinds of food. So eat more of your food earlier in the day, especially eat more of your carbohydrates earlier in the day. And then as the day goes on, cut back a little bit. Like sometimes just that in itself can help with insulin resistance. Then, of course, exercise, which we're probably going to talk more about, but exercise is super important. And I think there's a lot of myths on the internet. Like if you go on Instagram or just on the internet in general, there's a lot out there. Like if you have PCOS, you shouldn't do this kind of exercise. There was even one article that said spin classes cause PCOS, and
wow.
Don't do HIIT, don't run, just walk.
And what was their thesis for that? What was their premise? Like,
I think it's because maybe they were trying to say that it spikes cortisol, because cortisol could be involved with PCOS, especially if you have more of the adrenal type, where your adrenals are making a lot of the DHEAS. And if you make a lot of cortisol, if you have a lot of stress, you make more cortisol, and that can all be connected. But I think you have to pay attention to your body. And kind of one of the things that drives me crazy is there are different phenotypes of PCOS. Like, every woman is not the same. You're going to have some women who are going to have a ton of insulin resistance, a ton of inflammation. They're going to kind of be hit with everything. And that's probably the majority of women actually with PCOS. There's 4 main phenotypes. But then you might have a more milder type where they don't have the metabolic part. They only have the irregular periods, maybe the cyst on their ovaries, but they don't have the high androgens and all these other things. So the point is no one size fits all. But there's a lot of stuff on the internet where they say, if you have this type of PCOS, you can't do HIIT. Or if you have this type, you shouldn't lift heavy weights.
And are there any studies behind that, or is that just their best theoretical guess?
No, I think it's just marketing to whatever, to get more followers or to sell a book or something, But you have to pay attention to your body. I mean, there's a lot of Olympic athletes, and I don't know their names, but I have researched this, who have PCOS, and they're fantastic athletes. And I doubt they're saying, oh, I can't run fast because it's going to make my PCOS worse, or I can't lift a heavy weight. You have to pay attention to your body. If you take a HIIT class and you have PCOS and you feel horrible, or if it wipes you out, then maybe that's not good for you. Maybe you should do yoga or walk instead of run. You have to listen to your body, really. But exercise is a really important part of managing PCOS because it helps to decrease insulin resistance. And like what I like to explain to my clients is that your muscle cells want to use carbohydrate for energy, and they don't kind of need the insulin to open the door. So if you're eating carbs and you're exercising, your muscle cells are sucking the sugar into the cell, and you're not having to make all this insulin to get it down. So you're not making all the insulin, and it's helping with insulin resistance. And so the ideal program would really include a cardio component, a resistance or weight training component, obviously stretching, and then maybe some yoga. I'm a huge fan of yoga for PCOS. They've done a lot of studies on that, actually.
Because why specifically?
It helps to manage stress. And there's a large stress component in PCOS. They believe it could actually be not one of the causes per se, but kind of. Some women have more of the adrenal type of PCOS, where they make more of the DHEAS, and that's linked to stress. Stress can help. Yoga can help with mindfulness. It can help with sleep. There are actually real studies on it, which I can actually post them up and show you after if you want.
Yeah, no, that's interesting. So is there a certain percentage of it that they're attributing to PCOS? Like it could be 10% of it, 20% of it?
Of the
response, like stress could be, a certain percentage as a contributor to the actual condition.
They're saying about I don't know. I don't think they know that, because there's stress. There's stress in utero. I mean, there's stress when children are young and in their early teens. They believe that actually might be like kind of a cause of PCOS, kind of like you have the gene and then something kicks it in. So I don't think they have an actual percentage. It would be called trauma actually to a young child. Yep. But then just everyday stress in everyday life, it can definitely worsen your hormones. Stress can cause more inflammation. Stress can worsen insulin resistance. So it's all kind of connected, really.
So, well, go ahead. I'm sorry.
Oh, but the yoga. So I was just going to say about yoga, and there are studies behind a lot of this, is that yoga can actually help to decrease cortisol.
Yes.
It might help improve heart health. It can improve mood. It actually might help regulate menstrual cycles, and there are studies on that. Can help decrease inflammation, may help to decrease blood sugar and insulin levels, and may help decrease stress and anxiety. So I think yoga is great for PCOS.
So no exercise is really off the table. You're just encouraging people, try all sorts of different flavors and see how you feel.
Yeah.
and work
And
from
find
there.
what you enjoy. Like,
Of course. Yeah.
women feel this pressure, like, oh, I have to go to the gym. I hate it. But you know what? Then find something else. Go for a walk with your significant other. Do, an online, if you don't want to go to the gym, do like an online class. I did my first online yoga class yesterday, which I've never done before because the gyms are closed. And I was like dreading. I'm like, oh God, I'm going to hate this. Like, I don't want to do this. And I did it. You know what?
Not
I
so
actually
bad.
liked it.
Yeah.
I'm shocked.
I haven't
I'm
done
going
that
to do it
yet, but
again.
I'm getting there.
I'm going to practice my arm balances. I mean, I'm going to use it so you got to be open-minded, try something different, take a Zumba class, like, do something different.
So then when it comes to diet and nutrition then, so you're just telling them, leave out the processed carbohydrates, eat better carbs, eat cleaner meats. Or is there a ratio of macros that's preferred for somebody with this particular condition, or?
I think that puts, I mean, I guess I could say maybe 40% might be good, but I think everybody's different. And some, like, there are women who are lean. I should actually mention this. Anywhere up, I think it's like 80% of women are obese or overweight with PCOS. And part of that might be due to the insulin resistance, but there are also 25% or so, 20% who are lean. And so you can't tell someone who's lean to lose weight and you're going to help your PCOS, because if you do lose weight, and I don't like to always put the pressure on weight, but it needs to be addressed, is that losing weight will help symptoms with PCOS. If you're overweight, it will help fertility. It will help symptoms, and it's not losing a huge amount of weight. It's even losing 5 to 7% of your body weight. It's going to help decrease your risk of diabetes, but it can greatly improve insulin resistance. But for someone who's lean, they're not going to lose weight. So for somebody who's lean, they would definitely want to focus on like eating really healthy and not taking their carbohydrates really low. So to answer your question about macros, I think it varies very widely. You might have a lean, active woman who has PCOS, and if she takes her carbs too low, her body would perceive it as stress, and it might increase. She might have more of the adrenal type of PCOS, and she might get more stress from that, more cortisol, and that in itself could worsen her menstrual cycle and some of her symptoms. So somebody like that may want to have a diet that's like 50% carbohydrate. That's why I don't love doing macros. I like doing more kind of like a balanced plate. But then you have the other side, where a woman who's very insulin resistant might actually do well on a very low carbohydrate diet. But it's super, super individual. I'm not like pro keto, but I'm open-minded. And I actually went to a keto conference 2 years ago out west. It was actually very cool. It was 4 days long. It was all like research on keto diets. So I'm open-minded. I guess my concern is for somebody who does keto, maybe somebody who doesn't need to do keto because they're not highly insulin resistant and they might be causing more damage to themselves. Women with PCOS have higher rates of eating disorders and disordered eating. And now if you're telling yourself, I have to go on this keto diet, which a lot of women think they have to do actually, maybe because their doctor told them or they're reading on social media, like you can't have any fruit because you have PCOS. Like why, And like even me on Instagram, I'm the PCOS dietitian, but I might say like berries are good or, have some fruit, and I'll be like attacked. Why women with PCOS can't have fruit? It's like, where are you getting that from? So you have the keto people, but if it works for you, I'm not going to tell you not to do it. Like if you do keto and you feel great and you've lost weight and you're less insulin resistant and maybe all of a sudden now you're getting regular periods, good for you. That's awesome. Just make sure you're doing it in a healthy way, because there's bad keto and there's okay keto. So just do it with like healthy fats, not loading up on tons of animal fats kind of thing. So macros, it's hard to say. I might average at 40% carb or even 35%, but it really depends on the person. Very, very variable.
And Martha, intermittent fasting I know is a little different for women than it is for men. Would that be an approach for PCOS?
It could be. Maybe not my first approach. I like to talk about the diet, the diet for insulin resistance, the diet for inflammation, the diet for gut health. I like to do that first and then work on exercise and work on sleep and work on stress management, look at all that. And then if the person is still not getting any results, let's just say their goal is to lose weight, or their goal is to lower their hemoglobin A1C, then I might kind of say, okay, let's try some time restricted eating. As I'm sure you know, there are different kinds of intermittent fasting.
Yep.
I would never recommend somebody with PCOS do the full day fasting or the 5 and 2. I don't like to say never, but not on a regular basis, because eating like 600 calories a day, it's tough, it's hard. But time restricted eating, I think there are some benefits to it for sure. If you're eating, maybe start off with, well, I guess a 12-hour window if we want to take baby steps, right? Maybe you have your breakfast at 8 a.m. and you stop eating by 8 p.m. And if you can do that, then maybe go to a 10-hour window. Maybe your breakfast at 8 and stop eating by like 6. So I don't think there's any need to go to a stricter window than 8, especially if you're of childbearing years and you're thinking about getting pregnant, or you're trying to conceive. Your body could perceive that as stress, so it's maybe not a good thing. But a lot of people, have had some success with intermittent fasting. They feel good. So if it works for you, that's awesome.
Hydration, is that a factor?
It can help. What's that?
I'm sorry, hydration, is that a factor?
Do you mean with PCOS or
Yes.
with intermittent fasting?
PCOS.
No more so than anybody else.
Okay.
I mean, I think being hydrated is good for everybody. But so that was kind of the insulin resistant part. So we talked about like the exercise and then getting in lots of good nutrients like magnesium. Helps with insulin resistance, and cinnamon and vinegar and foods that are rich in polyphenols like berries, different tea. So there are so many foods that can actually help, and then get in healthy fats.
Are there specific teas you would recommend?
Probably the most studies have been done on green tea, but even for example with spearmint tea, there have been some studies on spearmint tea actually might help to lower androgen. So I think for women to drink spearmint tea, I think it's awesome. It probably has polyphenols in it as well, but all tea is good, but probably the best would be green and spearmint. And then, the sleep. Studies have shown if you do not get enough sleep, that you have increased risk of heart disease, diabetes. It decreases your insulin sensitivity a lot. It can make you hungrier the next day. It might be linked to weight gain. So sleep is an area I think a lot of women don't think about. They're thinking more about their diet, cutting out carbs, but they're not really thinking about, am I getting enough sleep? So it's kind of looking like all of that really. And then the stress management, because stress definitely can worsen inflammation and insulin resistance. So it's finding ways to deal with stress.
Yeah, and sleep can be so elusive. You could be laying in bed for 10 hours a night and maybe get like 1 hour of good sleep. That's something that really, I recommend people get some sort of Fitbit or some sort of device so they can measure what's actually going on. Yeah. So they know what's going on when they're sleeping. Because if you're not getting that, you're just you're already awake. You're starting your day behind the 8 ball.
Totally. And they have done a lot of studies. Women with PCOS do have higher rates of sleeping issues. Part of it is sleep apnea, and you should probably, if you have a partner who can hear you snore in bed, like my boyfriend doesn't have PCOS obviously, but he was snoring and making noises, and I kept telling him, he didn't believe me, so I tape recorded him so he could hear it, and then he still didn't really think it was serious. And then one time in the middle of the night, he was gasping, he couldn't breathe, and he woke up and he was terrified. That's a sign of sleep apnea. So he went to the doctor and he got that little test, and he has this. Now he has to wear CPAP. But if you have PCOS and you're always feeling kind of like tired a lot, you should definitely talk to your doctor about, could you possibly have sleep apnea? And you also, I guess, while I'm on the subject, if you're feeling tired a lot, you also want to talk to your doctor about that, because you want to make sure you get your thyroid checked, because there is a link between thyroid diseases and PCOS. So you want to make sure you get a full thyroid workup, because that could be a cause of fatigue, and it could be a cause of hair loss too, actually. And you also want to make sure you have your micronutrients tested, like iron. You could be anemic, and that could be a cause of fatigue also. And if you're taking metformin, which a lot of women do, that could also cause you to become deficient in B12. And that could be a type of anemia also. So you always want to make sure if you're on metformin that you get your B12 levels checked.
Let's talk about the micros then. Are there any other ones that would be specific to this condition? Would you recommend people just be on a good multi?
Yeah, I think, I think I would definitely recommend that you get your, get those main ones checked. Like you can get your folic acid checked. You can get your iron levels checked. You can get B12 checked. I think it's not a bad idea to be on a general multivitamin. And there are certain nutrients, for whatever reason, that women tend to be low in with PCOS. Oh, vitamin D, I forgot. Vitamin D is like the super one, really. A huge percentage of people in general, but especially women with PCOS, for whatever reason, are low in vitamin D. And that's linked to like everything. If you're low in vitamin D, it could worsen your insulin resistance. It plays a role. It's actually a hormone. It plays a role in so many different parts. So definitely have your doctor check your vitamin D levels. I oftentimes recommend a good multivitamin, but you might need more. Like you're probably going to need extra vitamin D. You might need more B12. Right. But nutrients of concern for PCOS tends to be vitamin B12, tends to be magnesium, and that's not easily picked up in a blood test. You'd have to have like a special micronutrient testing, because when you just get your general blood test done, it's more just what's in your blood. It's not what's in your stores. So it's not a bad idea to take a magnesium supplement. I would take probably 400 milligrams a day. Zinc is oftentimes low with PCOS. Potassium might be, chromium, vitamin C, folate, like those are the common ones. So kind of without knowing the person, like I kind of like to see blood work first. Probably most women would benefit from taking a vitamin D, but definitely get that checked in your blood work. Definitely get your vitamin B12 checked in your blood work. You might need more, but I would take just a regular multivitamin. And you may also want to take an extra magnesium. And one other one, which we didn't talk about, was omega-3 fish oil. So I'm a huge fan of omega-3s. They might help with insulin resistance. They help to decrease inflammation. They might help with PMS. They might help with skin and hair. It's a really important one. So you may, if you're not eating fatty fish like 4 times a week, which most people probably don't, I might also recommend that you take an omega-3, like 1 to 2 grams a day.
Are there any herbs or glandulars that might benefit PCOS in the literature?
Honestly, that's not my area of expertise. There may be, but there is another. You would want to work with a very qualified practitioner on that. But there is a supplement I recommend all the time, and it's inositol. Inositol, and it's basically it's kind of like a vitamin B. It's not vitamin B, but it's kind of like it. But it's been researched in hundreds of studies. Like if you go into PubMed and you look up inositol and PCOS, there's so much out there. It might help to. It's actually almost if not as effective as metformin. In kind of a different kind of way, a little bit. Works similar, but a little bit different. So it can improve insulin resistance. It can also induce ovulation. It might help lower free testosterone. So it can do a lot, and the dosage would be 2 to 4 grams a day.
Just inositol? Because a lot of times companies will brand package those together as choline and inositol.
What I prefer is there are different kinds of inositol. There's myo-inositol and D-chiro-inositol. My preference, and I don't want to like give shout outs for brand names, but right. It is a combination of a myo and a D-chiro-inositol. And I guess, one brand that I don't get paid or I don't like promote them, but it's called ovositol, and it's the ratio of the 40-1 of the myo to the D-chiro ratio 40-1.
Ovositol, interesting.
Yeah. So that has a lot of studies behind us, and so that's a great one. Another one that sometimes I use would be NAC, N-acetylcysteine, and that is studies have shown that might actually help to decrease fasting insulin and testosterone in PCOS. It also might lower insulin and may help a little bit with weight loss, and that dose would be 600 milligrams 3 times a day. So that's another common one that I use with PCOS.
And what's your success rate with people managing it through lifestyle? Is it pretty high?
Yeah, people, it's hard, like probably not every single thing is going to get better just with lifestyle, right? So if you're having hair loss, let's just say very bad hair loss and irregular periods, and you're very overweight and you're tired all the time, I kind of like to set people up with like small goals. Maybe the first goal would be to start to have more energy and just have a better mood. And then you would just slowly start to lose some weight. And then your cycles would start to get a little more regular. And then eventually your hair loss is going to improve. So it's not like you're going to do diet and exercise and all of a sudden in 1 month, everything's going to go away.
Right.
Some women still do need some medications, especially if they're trying to get pregnant, but a lot of women can manage this with lifestyle.
Is there an emotional component? Do women who experience this lean toward depression or subclinical depression?
There's a huge emotional component towards it. And actually, one of my colleagues wrote a book which I would highly recommend, called The PCOS Mood Cure. And women with PCOS have much higher rates of depression, actually 10 times higher rates of depression, 5 times higher rates of anxiety. And it's believed that 60% of women with PCOS have at least one mental health concern. So this is so important now that they actually put it in the guidelines for PCOS, like the medical guidelines, like all women should be screened for any kind of mental health issues. And there are real reasons why it can happen. They actually have shown abnormal levels of androgens and other hormones are linked to mood disorders. There's also links between insulin resistance in itself with anxiety and depression. And then of course you have these symptoms, right? These symptoms where you can't get pregnant, you're gaining weight, you're losing some hair. Of course, that's going to get you upset. So that could certainly cause a mood disorder. And then also women with more of the adrenal PCOS who have the high DHEAS, they've done studies, they may have increased rates of anxiety. So there's definitely an emotional component to it. So that should not be ignored. Get help, have a counselor, have a therapist
Right.
to work with you on that.
What are we looking to the future? Like, what are the big questions that we're trying to get resolved with this particular condition?
Yeah, I mean, that's a really good point. There's this organization, I'm on the health advisory board for the PCOS Challenge. They're the largest nonprofit association for PCOS, and they're heavily involved in advocating for research. And I've known them for probably 10 years. And I mean, what they've accomplished now is just amazing. So if you go to their website, it's called the PCOS Challenge. And I would highly recommend, women to get involved with that because you can become advocates. We just went to DC a couple weeks ago. It was to advocate for PCOS, to advocate for research, for funding, for awareness, because it's only 0.1% of all funding is for PCOS, for all medical conditions. So it's 0.1%, not even 1%. So we need more research because they need to understand like what's causing this, what can be done. They're finding little clues. Like there's a little clue, women with PCOS have higher levels of anti-Müllerian hormone and, higher levels of BPA in utero. So, but they need to figure out kind of what's going on and what else can we do? Can there be a cure? Can we educate more physicians so more doctors will know about it and more women can get treated? So it really needs to be more education, more awareness, more funding, more research is really what it comes down to.
Because there's such an emotional, stress-related component, have you, through your own experience, ever seen somebody just kind of overcome it just by working on that part of their life?
Oh, yeah, sure. The emotional component. Absolutely. Yep.
And then the other symptoms tend to dissipate over time?
I haven't followed somebody for that long, but I know that Dr. Gretchen Kubacki has an amazing Facebook support group. It's I think it's called PCOS Psychology. It's really working with a therapist and working with somebody because the thing about PCOS is there's no one easy answer. Okay. You don't just say, I'm going to cut out carbs and everything's going to get better. needs to be treated by many different ways, and everyone's different. I mean, maybe one woman could cut out carbs and everything would get better. Maybe
Right.
that's all she needs to do. But most women, you need to kind of look at where you're at, what's going on with you, and you probably need to address your stress, and you need to address your sleep, and maybe take some supplements, and maybe get some kind of counseling. Maybe you might need a medication. Look at your diet. So you have to look at all these little things, and everyone's different. If you read on social media that somebody's doing this particular thing and they're taking this particular supplement, like, don't run out and think you have to do the same thing that everybody else is doing, because you're probably going to waste your money and you might end up hurting yourself.
Gotcha. So Martha, if somebody wanted to reach out to you, to contact you about this, I know you do personal counseling with this. You do one-on-one. I assume you do some online, and you have a course that you just offered as well, too, correct?
I do. Yeah, I do. If you go to my website, Martha McKittrick Nutrition, and I have a whole PCOS blog on there, and I have tons of free stuff. So you can take a little quiz on my website, and you can get a free a week's meal plan. I have all these. I have plant-based. I have low carb. I have moderate carb. I have a free nutrition little guide. I just launched a course on PCOS. It's a 6-module course where you'll get tons of information and recipes and idea for meal plans, and a lot of education on insulin resistance and inflammation and gut health. So that just launched, and I'll be launching another one in a couple months. And then I also do one-on-one coaching in my office and virtually. So you can reach out to me through my website, and I can help you out with a plan.
And PCOS is not the only thing you cover, right? You do all sorts of...
No, that's one thing that I do. I specialize in working with really busy people who need very practical guidance for eating more healthy, kind of on the run. And I do pre-diabetes and diabetes. I do a lot of gastrointestinal issues like IBS, heart health, pretty much everything, really. But my plans are all tailored to the person. I'm also a certified health and wellness coach. So I address the whole kind of area, the more of an integrative approach. And I like to make it practical and things that you can do.
Gotcha. And spell your name. Just so, because it's marthamckittrick.com, right? Or,
right.
No, it's,
yeah. So it's Martha. It's MarthaMcKittrick nutrition.com. And on Instagram, I'm the PCOS Dietician.
Instagram, got it. So before we close out, are there any other issues you'd like to address that wasn't a question of mine that we didn't hit that you still want to bring to the table?
I think we kind of covered all of it. I mean, I think the good news with PCOS is that you want to try and get a good healthcare team together. If you don't like your current physician, try and find somebody who specializes in PCOS. Ideally, you would want to work with an endocrinologist. I know it can be hard to find somebody who specializes in PCOS, but there are people out there. But definitely, when you're searching, look for endocrinologists and look for somebody who specializes in PCOS. And you want to get a good support system together. Just explain to the people in your life what this is. Maybe check out the PCOS challenge. Social media is awesome, but it can also create a lot of overwhelm and a lot of confusion. So use social media wisely. Follow people who kind of uplift you versus bring you down. And consider working with somebody, a dietitian who's near you, or contact me to get some coaching so you can help to navigate this, because you can definitely decrease your symptoms and you can definitely get pregnant. And decrease your risk of diabetes and lose weight if you're doing it the right way with nutrition and lifestyle. So you can take charge of your symptoms, but you just want to kind of take a deep breath and take it step by step.
And that is a strong point to end on. So we'll just wrap it up there.
Yeah.
Thank you so much for your time. I really appreciate it. And you already gave us your contact information. I'll put it up online as well, so if people can want to reach out to you, they can. Martha,
Awesome.
Thanks again.
Thanks so much, James. It's been a pleasure.
I'll talk to you soon.
Take care. Bye-bye.